Welcome to the STEMS Health Miami Stem Cell Therapy Podcast. STEMS Health is a regenerative medicine clinic in Miami Beach, specializing in advanced non-surgical treatments that help the body repair and restore itself. Visit stemshealthregenerativemedicine.com for more info or to book an appointment. From stem cell and PRP therapies to peptides, IV treatments, and hormone optimization, our focus is on helping you feel, move, and perform at your best. This synthetic podcast brings you clear, physician-guided insights into how these treatments work, what to expect, and how regenerative care is transforming modern medicine. Now, here is today's topic. Muse cells and mesenchymal cells for healing injuries and reducing pain. Cell-based therapy is one of the most promising frontiers in modern regenerative medicine. Every year, scientists uncover more about how our own cells can be used to repair, rebuild, and even restore damaged tissues, offering new hope for people struggling with chronic pain or injury. Two of the most exciting cell types at the center of this revolution are mesenchymal stem cells, often called MSCs, and a newer discovery known as Muse Cells, short for Multilineage-Differentiating stress-enduring cells. Both have incredible potential to relieve pain and promote healing, but they work in very different ways. In this episode, we'll break down how each cell type functions, what makes them unique, and why they're shaping the next generation of regenerative therapies. Let's start with mesenchymal stem cells, or MSCs. MSCs are multipotent stromal cells, meaning they can turn into several different types of tissue cells, but not all of them. Originally discovered in bone marrow, they've since been found in fat tissue, umbilical cord tissue, and other parts of the body. When MSCs are introduced into damaged or inflamed areas, they don't necessarily replace cells directly. Instead, they communicate with surrounding tissue through biochemical signals, releasing growth factors and cytokines that help your body heal itself. Think of them as master coordinators of repair. They help reduce inflammation, stimulate new blood vessel growth, and signal nearby cells to begin repairing damage. MSCs can differentiate into bone cells, cartilage cells, fat cells, and muscle cells, which makes them especially useful in treating orthopedic injuries, joint degeneration, and soft tissue damage. They're already being studied and used clinically for conditions such as osteoarthritis, tendon injuries, and spinal disc degeneration. Now let's talk about Muse cells. Muse cells are one of the most fascinating discoveries in regenerative biology in recent years. First identified in 2007 by Japanese researchers, Muse cells are a naturally occurring subset of stem cells that exist in bone marrow, blood, and connective tissue. What makes Muse cells different is their pluripotency, meaning they can transform into virtually any type of cell in the body. Nerve cells, skin cells, liver cells, heart muscle. Muse cells have shown the ability to become them all. They're also uniquely resilient. Unlike many other cells that die off under stress, Muse cells can survive in extreme environments, such as areas with poor blood flow, inflammation, or oxygen deprivation, precisely the kinds of conditions you find in injured or degenerating tissue. That resilience makes them ideal candidates for repairing damage where other cell types might not survive long enough to make a difference. So what are the key differences between MSCs and Muse cells? Let's compare them directly. Origin. MSCs are multipotent cells found in bone marrow, fat, and connective tissue. Muse cells, meanwhile, are a small, naturally occurring subset within those MSC populations, just a tiny fraction of the total. Differentiation potential. MSCs are multipotent, meaning their ability to transform is limited to certain cell families. Muse cells are pluripotent, giving them the power to become almost any cell type in the body. Stress resistance. MSCs prefer supportive, stable environments. Muse cells can thrive under stress, which means they survive better inside damaged or inflamed tissue. Tumor safety. Both MSCs and Muse cells are considered non-tumorigenic, meaning they don't form tumors, but Muse cells have shown an even lower risk profile in laboratory studies. Mechanism of action. MSCs mostly work through signaling, releasing growth factors and molecules that stimulate healing. Muse cells take it a step further. They become the new tissue, directly integrating into the repair site. Let's look at how each cell type actually aids in the healing process. Mesenchymal stem cells act as mediators. When introduced into the body, they release compounds that reduce inflammation, promote blood flow, and calm the immune system. They don't necessarily turn into new cells themselves, but they create the perfect environment for the body to heal naturally. That's why MSCs are used in so many regenerative applications, from treating arthritis and tendon damage to managing autoimmune inflammation. When the inflammatory response is reduced, pain decreases and tissue function begins to return. Muse cells, on the other hand, work more like builders than managers. They travel directly to the site of injury, a process known as homing, and then transform into the exact type of cell that's needed. In cases of nerve damage, they can become functioning neurons. In cartilage loss, they can become new cartilage cells. Once they've arrived, they integrate into the tissue and start functioning as if they were native to that part of the body. That's what makes Muse cells so exciting. They don't just signal the body to heal, they become part of the new healed tissue itself. Now, when it comes to pain management, both cell types have shown significant promise. MSCs are already used clinically to help reduce chronic pain caused by inflammation and degeneration. They help by calming overactive immune responses, reducing inflammatory cytokines, and supporting tissue repair. For example, in osteoarthritis patients, MSCs can help regenerate cartilage and reduce joint swelling. In tendon injuries, they can improve recovery and reduce scar tissue formation. Patients often report less pain, greater mobility, and improved quality of life after MSC-based treatments. Muse cells, meanwhile, offer a different kind of hope, particularly for chronic or nerve-related pain. Because Muse cells can become neurons, muscle fibers, or cartilage cells, they have the potential to replace the damaged cells that are causing the pain in the first place. Imagine repairing a nerve injury not just by calming inflammation, but by regenerating the nerve itself. That's the direction Muse cell therapy is heading. They're being studied for their ability to repair spinal cord injuries, rebuild damaged cartilage, and even help regenerate cardiac tissue after a heart attack. So what does the future look like for these two remarkable cell types? Mesenchymal stem cells are already well established. They're widely available, well studied, and being used in clinical practice around the world. They offer a reliable option for many patients today. Muse cells, on the other hand, represent the next wave, a leap toward true regeneration. With their pluripotency and stress resistance, they could redefine what's possible for chronic pain, neurological recovery, and severe tissue damage. Some experts even believe that the future of regenerative medicine will combine both: MSCs to reduce inflammation and modulate the immune system, and Muse cells to perform direct tissue regeneration. That kind of dual therapy could offer the best of both worlds: faster recovery, longer-lasting results, and the potential for actual tissue renewal rather than temporary relief. As research progresses, one thing is becoming clear: the human body holds extraordinary power to heal itself. And these cell-based therapies are unlocking that potential in ways that were unimaginable just a decade ago. If you're exploring regenerative treatments for pain or injury, consult with the team at Stems Health in Miami Beach. Their board-certified physicians specialize in advanced biologic therapies that combine precision, safety, and cutting-edge science to help patients recover naturally and restore performance. The next era of healing isn't coming. It's already here, one cell at a time. That's all for this episode. Thank you for listening to the Stems Health Miami Stem Cell Therapy podcast. This podcast is for informational and educational purposes only and does not constitute medical advice. Listeners should consult a licensed healthcare provider for individual diagnosis or treatment. Some therapies discussed may be considered investigational or are not approved by the FDA. Results and outcomes vary for each person, and no guarantees of benefit are implied. All participation in such treatments is voluntary. To learn more about regenerative and restorative treatments, visit stemshealthregenerativemedicine.com or schedule a consultation at our Miami Beach clinic. Stay tuned for the next episode of the Miami Stem Cell Therapy podcast, and have a great day.